Welcome back to AAT Learning Hub. I'm Bhumika Anand, a cardiac physician associate, and today's lecture is about anatomical movements, which is a part of Introduction to Anatomy. So if you haven't checked my lecture on anatomical terminologies, please do watch that before you proceed on with this. Anatomical movements can be defined as the act of moving the bodily structures, or as the change of position in one or more of the joints in the body. Movements are usually described in relation to anatomical position. In the last lecture, we had seen what is anatomical position. As a quick refresher, standard anatomical position is the subject standing straight and facing forward, arms hanging at the side slightly away from the trunk with palms facing forward, and legs placed together with feet facing forward. And for any movement to occur, you need an axis. An axis is a straight line around which an object rotates. So just like how you have the earth rotating on an imaginary axis, the wheel rotating with the support of an axis, our body also has imaginary axis. Please follow this diagram. I'll tell you a very easy method to remember this. There are 3 axes of rotation, and all the 3 axes are imaginary lines that run perpendicular to the imaginary planes in our body. So first is sagittal axis. Sagittal axis is perpendicular to frontal plane. What is frontal plane? Frontal plane divides the body into a anterior and posterior part. So this sagittal axis runs from front to back. Next is frontal axis. Frontal axis is perpendicular to sagittal plane that divides the body into a left and a right section. So frontal axis runs side to side. The last one is longitudinal axis. This is perpendicular to transverse plane, which divides the body into an upper and lower section. So longitudinal axis runs from top to bottom. So perpendicular to frontal plane, front to back, sagittal axis. Perpendicular to sagittal plane, side to side, frontal axis. And perpendicular to transverse plane, top to bottom, longitudinal axis. Let's move on to the different types of body movements. First is flexion and extension. Flexion refers to a movement that decreases the angle between 2 body parts. Example, when you flex your elbow, you're decreasing the angle between the ulna and the humerus. When the knee flexes, the angle between femur and tibia gets smaller. Extension is opposite of flexion. So when you extend the elbow, you're increasing the angle between ulna and humerus. When you extend the knee, it straightens your lower limb. What is hyperextension and hyperflexion? So there is another movement which is abnormal or excessive extension of a joint beyond its normal range of motion. So that's either hyperextension or hyperflexion. Let's look at some examples of flexion and extension. Chin towards the chest is flexion of neck. The second one is extension of neck, where the head is tilted back. Then you have flexion of arm, extension of arm, flexion of knee, extension of knee, flexion of fingers, and extension of fingers. The second one is abduction and adduction. What do you mean by abduction? When someone is being abducted, they're being taken away. So abduction is a movement away from the midline. So when you abduct the fingers get spread out. Abduction of shoulder raises the arms out to the sides of the body. Opposite of this is adduction, a movement towards the midline. Adduction, add. So when you add, all the fingers come close together. Adduction of fingers. Adduction of shoulder brings the arms closer to torso. The third one is circumduction. Circumduction is a conical movement of a limb extending from the joint at which the movement is controlled. Basically, a circular motion. The fourth one is medial and lateral rotation. Medial rotation is the rotational movement towards the midline. It is also referred to as internal rotation. When you flex your elbow and bring it close to the chest, as if you hug somebody, it is internal rotation. And when you move the arm away from the chest, as if you are holding a tray, it is lateral rotation, also called external rotation, wherein you move your arms away from the midline. Fifth is supination and pronation. With shoulder and elbow still, turn your hand onto its back, palm up. This is supination. So imagine holding a bowl of soup in your hands. How will you hold it? So that is supination. Soup, supination. With shoulder and elbow still, flip your hand onto its front, palm down. This is prone position. So this movement is named pronation. So when you lie flat on the back, the body is in supine posture. When you lie down with your stomach touching the ground, your body is in prone position. The next, sixth, is apposition and reposition. Apposition brings the thumb and little finger together. Reposition is opposite movement, which moves the thumb and the little finger away from each other. Seventh is dorsiflexion and plantar flexion. These are terms that are used to describe movements at the ankle. They refer to two surfaces of the foot, the dorsum or the superior surface, and the plantar surface, which is the sole. So dorsiflexion is flexion at the ankle where the foot points more superiorly, as if you stand on your heel. And plantar flexion refers to extension at the ankle so that the foot points inferiorly, like standing on your toes. Eighth is inversion and eversion. These are also movements that happen at the ankle. Inversion involves the movement of the sole towards the median plane so that the sole faces in a medial direction, whereas eversion involves the movement of the sole away from the median plane where it faces the lateral direction. Ninth is elevation and depression. Elevation refers to a movement in a superior direction, like you shrug your shoulders, saying you don't know. Depression refers to a movement in an inferior direction. Example is like when you are surprised or shocked, you open your mouth, bringing your mandible down. So that's depression. The last one is protraction and retraction. Protraction describes the anterolateral movement of the scapula on the thoracic wall that allows the shoulder to move away anteriorly, as if you are reaching out to something. Retraction refers to posterior medial movement of the scapula, which causes the shoulder region to move posteriorly, as if you pick up something. So this protraction and retraction also happens at the mandibular joint. So these are the various types of movements that happen in human body. Hope this video was helpful. Any feedback or queries, please leave it in the comment section. Stay connected with AAT Learning Hub. Never stop learning because life never stops teaching. Thank you.